Hi, everyone. So I'm Betsy Davies, Program Coordinator here at Give Us Wings in St. Paul, and I'm so glad to see so many of you here today. Yes, I just wanted to give a brief history. Many of you know about St. John's Cairo Health Center, but I thought I'd give a little history about how it came to be. In the early 2000s, the people of Cairo and Tororo and Eastern Uganda made it really clear to us that there were many needs, of course, education and economic development needs, but primarily healthcare. There just wasn't access to affordable, quality healthcare. And women shared stories of their friends and sisters walking for miles to get to a local hospital that once, if they made it there, was not the kind of quality they needed, and it was unaffordable. And there were even tragic stories of women dying on the road trying to go give childbirth at a hospital. So we got to work and started to raise as many funds as we could to build a health center. In the meantime, when volunteers would go over on our volunteer trips to Uganda, we would put together some rudimentary health camps and just put a tent up and try to get a nurse and doctor to see folks in the community. And it just became crystal clear that there was such a need for some basic health care to be provided for these folks, addressing malaria, strep throat, pneumonia, giving childbirth, birth in a healthy way. So thanks to many generous donors, and in particular the parishioners of St. John the Evangelist Episcopal Church in St. Paul, we were able to buy land and break ground. And in 2011, we opened up the St. John Cairo Health Center. It was at that time one building. There were a few rooms in there for examination and a small lab and a check-in room. And people came from all over, and it was really, really exciting. I was there in 2011 when that opened, and Anthony and I were there together. Then as time went on, thanks to many more generous donors and continued support from St. John the Evangelist Episcopal Church parishioners, we expanded, and now there's a maternity ward and there's an inpatient ward for overnight care for men and women. There's staff housing, and so we can be open 24 hours a day, 7 days a week. There's an actual compound now, this lovely, safe place for affordable, accessible healthcare that used to just be an open field. And so it's really exciting, and it just keeps growing and growing. So that's a little bit of a background about that. Anthony, I wanted to ask you to tell us a little bit about your background, your education background, what work experience you had, and what drew you to Give Us Wings.
Thank you so much, Betsy, and thank you, Peter Carlson, and everyone else that has come on board. My name is Anthony Munene. I work with Give Us Wings as a program officer in charge of health, and I'm delighted to be part of all these activities that we have. My educational background, I have a bachelor's degree in human resource management from the Islamic University in Uganda. I have a certificate in postgraduate, I have a certificate in project planning and management from Uganda Management Institute. But as well, right now, I'm currently pursuing a master's degree in business administration. What drew me to Give Us Wings? Before I came to Give Us Wings, I was working with Tororo District Local Government, and in particular, I was attached to the education department, where I was in charge of doing a number of activities or roles. For example, handling complaints from the teachers about their pay, handling matters concerning their staff performance appraisals, and many other things. So before I joined Give Us Wings, I had a friend who told me about Give Us Wings and the work that they do. So I felt drawn to go and explore my options of probably working with Givers Wings. Fortunately enough, I approached Givers Wings in 2012 around August, and I applied for a position of a volunteer, and I was accepted. So I have slowly worked as a in various capacities in Givers Wings. I have worked as a volunteer. I have worked as an administrator and a cashier at St. John's Cairo Health Center. Thereafter, I was promoted to a program manager in charge of health. And currently, I am working as a program officer in charge of health as well. So I have been involved with Givers Wings for about 10 years plus. And I must say it is a privilege and really an honor to be part of this great team and the work that they do for the vulnerable people in the community.
Thank you. And I think then we'll switch it over to Peter. You have some questions.
Yeah, so it is an honor to have you, Anthony, with us. We are so appreciative of all the work that you do. I'm wondering if you can just give us a quick overview of St. John's Cairo Health Center and what services does the clinic offer?
Yeah, just like Betsy said, St. John's Cairo Health Center is a private not-for-profit health facility. And in terms of designation, we are level 2. So what are the services that we provide currently right now at St. John's? We have laboratory services. We also have delivery services where women come and give birth 24 hours, 7 days a week. We also have child immunization services. We have family planning services for men and women of reproductive ages. We also have an inpatient ward where we have inpatient services. So we have a 20-bed capacity inpatient ward where women and men get admitted at night. We also have antenatal services. We also have postnatal care services. We also have community outreach services to particularly areas that are medically underserved here in Tororo. We also have treatment services, as well as we also have client follow-up services where we move out to the communities, particularly to the clients that have been able to be discharged, trying to follow up on their drug adherence, and also trying to do some kind of check to make sure that they are doing okay, maybe they're following the medications that they have been asked to take. We also have a community health insurance scheme, which in the eastern part of the country is a unique kind of service that we are providing at St. John's, where people are able to access affordable and quality healthcare services at a very slight fee. Recently, I want to say with great thanks to St. John's Episcopal Church, with Givers Wings International, that we were able to launch the ultrasound scanning services. So that is now a plus to us in the community and to the surrounding environment. Surrounding environment. Thank you.
Right. You mentioned that St. John's is a level 2 clinic. Can you explain what that means and how many levels are there?
Thank you so much, Peter. According to Ministry of Health here in Uganda, and in particular to the guidelines for designation, establishment, and upgrading of health facilities, we have various numbers for categorization of health facilities. So we have Health Center 1, and the Health Center 1 is basically listed as a VHT, that these are village health team workers. So per se, in as much as they're Health Center 1, they actually are not listed, they are not, okay, like they do not have,
Uh-oh, Anthony, we seem to have lost your audio, but you're not muted. Can you still hear us? No, we still can't hear you.
What about now?
There, it's back.
Good. Okay. All right. Sorry about that. As I was saying, we have various categorization of health facilities that we have here in Uganda. We have Health Center 1, and the Health Center 1 is basically known as a VHT, that these are village health team workers. And these village health team workers have a target set by them, by the Ministry of Health, that they must be able to attend to 1,000 people annually. Then we also have Health Center 2. And the Health Center 2, in terms of, okay, we are supposed to serve 5,000 people annually. We also have Health Center 3, and the Health Center 3 is supposed to serve 20,000 people. We also have Health Center 4, and the Health Center 4 is supposed to serve 100,000 people annually. And after that, we also have a district hospital, and a district hospital is supposed to serve 500,000 people annually. And we also have a regional referral hospital, and the regional referral hospital is supposed to attend to 2 million people annually. And then the last one is a national referral hospital with an unknown or an attached number of people it serves annually. So as a health center too, what does that mean? It means that a number of services are supposed to be provided. For example, outreach services. A health center 2 is supposed to provide emergency deliveries. A health center 2 is supposed to provide treatment interventions. Health center 2 is supposed to provide child immunization services. And as well, health center 2 is supposed to provide health education services.
Right. And as I understand it, Anthony, we are still level 2, but we're very close to level. We're on a very high end of level 2, right? We serve many more people than 5,000 annually.
Yes. When we started, when we opened our doors at St. John's, we were able, on that particular year, we were able to provide a total of 452 people with services. But then looking backwards, like last year, for example, in the year 2022, when we closed down the year, we were able to provide health interventions to 36,000 people just for last year. So that tells you that in terms of the number of people that we have been able to reach out to is more than what we are actually supposed to be providing. But we are not complaining. We are actually happy that people are taking advantage of all the health interventions at our health center, and that they are able to come and be, served as they should. Yeah.
Yeah, that's so great. Those numbers are amazing. Can you tell us a little bit about the challenges that you face operating a clinic in that part of Uganda? And maybe, given this morning, you can start with electricity.
Yes, yes, we did have a challenge of electricity. Actually, in terms of electricity, I will say that since we started operating, we were able to only access electricity in the year 2021. So at St. John's, we've only had power for only 2 years, electricity. But before then, we had solar power. Among other challenges that we also have working in the community, and I want to mention in particular St. John's Kayoro, in terms of where it is designated, we operate in a rural environment. And operating in a rural environment means that there are many other challenges that people in the community face. In Uganda, we are located in the eastern part of the country. And if you look at the statistics in terms of wealth, distribution and, people being poor in the eastern part of the country. This is where most of we have poor people, and we have very many, underdeveloped, communities. But of course, this also means that as a health center or as an organization, we're supposed to still continue providing social services to these people. And one thing I appreciate Give Us Wings for. But again, to go back to the challenges, we have challenges of poor health-seeking behavior. We still see people practicing unconventional practices, for example, practicing witchcraft, practicing self-medication. We still have those challenges. We have people who look at conventional medicine as the last resort. We still have a challenge of distance. Just like Betsy said, there was a problem of people moving long distances. That is still there. It's not yet sorted, but it is still there. So we still have those challenges where, for example, we get women, expectant women laboring, giving birth on the roadside, before they are able to come to the health facility, still because of, long distances. And also we have very many low-income households. So having very many low-income households means that not very many people are able to access medical healthcare services to pay for them, to pay for themselves. And really that is why, St. John's now comes into play. That St. John's has been able to provide a number of interventions, regardless of all these challenges that I have mentioned. For example, how do we address the issue of low-income households? We have established a community health insurance scheme where people, very many people, hundreds of people, have been able to enroll and have been able to keep renewing their membership to be able to get affordable healthcare services at St. John's. We've also subsidized majority of our services. If you look at the services that we provide at St. John's and you compare it to a private facility, you would be amazed and you'd ask yourself, so how do these guys do it? So the subsidized cost is something that we do, and it's based on the many partnerships that we have over the years been able to establish, so that we are able to mitigate and help the poor community not to be suffocated, to really look at healthcare, paying for their healthcare as something something that they cannot do. I also want to say that we have also targeted, our services are actually need-oriented. So we as Give Us Wings, when we are rolling out our services, in particular to the health program, we do not impose the services on the people. The people are the ones who tell us, these are the services that we need. And then as Give Us Wings, we are able to provide and tailor those services to their needs. And really that is one of the things that has really catapulted those numbers that I mentioned earlier, to really have thousands of people coming and keep streaming, to our health facility. Yeah, I think that is that for now. Yeah.
Thank you. Can you talk just a little bit more about the community health insurance program that you've mentioned? And especially as we all of our sponsored families through the family to family program, that's part of their sponsorship, is that we enroll them in that community health insurance program. So what benefits does that bring to them?
Yeah, thank you, Peter. I want also again to appreciate Give Us Wings for taking this initiative of enrolling the sponsored families from the family to family education support program to be able to access health insurance services at St. John's. This health insurance service or scheme, it's like, again, I said, it targets low-income households to be able to affordably pay premiums, each quarter to access quality services. In 2020, Give Us Wings International, in light of the pandemic, COVID-19, thought it wise to have members of the sponsored family come on board and to be able to access critical medical healthcare services. And I want to say that the scheme has been very, very popular. It has been very popular. It has really catapulted a lot of interest in the communities. But I also want to say, among the many services that these people are able to benefit from, provision of medical care. They are able to come to St. John's, get the treatment, the laboratory tests done on a 24-hour basis. There's also access to medical supplies, to be able to prevent diseases like malaria. Recently, we started providing mosquito nets because we realized that a number of our clients were suffering majorly from malaria. So one of the benefits that the members of the FACE program have been able to benefit so much from is the distribution of the mosquito nets, in the prevention of malaria. And also I want to say, unfortunately, before then, we also observed that a number of, our clients were really, suffering from malaria. And unfortunately, we had a case where a young boy, passed on because of malaria. But all these have not stopped us from continuing to provide the services. Among the other services that people are able to benefit from is the specialized services. For example, we have devised a service known as a Doctor Day, where we invite a specialized doctor. And this specialized doctor is able to come on a quarterly basis and provide consultative services, but as well also as treatment services. Just to put things into perspective, you see, doctors usually charge about $10 to clients just to be able to get consultative services. But one of the beautiful things about Give Us Wings is that from what we have tailored over the years, a client can be able to walk in and see the same doctor at only 85 cents, in dollars. That tells you that people are able to afford, and people are able to appreciate, and people are able not to fear, to come to health facilities to be able to get services, but rather look at health facilities, just like St. John's, as a life-saving, health facility. The other service that people are also able to benefit from is the client follow-up. This client follow-up, in particular to 2020, when we had COVID-19, we thought it wise to come up with this particular service, not only just to when we discharge a client, and that is where, the point of care ends, but we also said, can we also follow up these clients to their households and probably understand what are the reasons as to why these clients are probably falling sick of a particular disease, and how can we, as an organization, as a health center, be able to address, those issues. One thing is that as an organization, we do not so much look at curative bit meaning that our interventions are about curing, but also we want to also prevent, diseases from happening. We also want to promote healthy practices so that people are able to be economically empowered, to be able to do, economic things that are able, to propel their households to the next level. Among other services, again, delivery services, there are quite a number of benefits that these, FACE-sponsored families, benefit from the health insurance scheme at St. John's.
Thank you. The client follow-up that we do is a good example of how the healthcare work in Cairo goes beyond the walls of the actual clinic. Are there other ways? Are there other things that we do in our healthcare program that is outside of the clinic itself and even outside of Cairo village?
Yes, yes, there are very many other services. For example, the community outreach. The community outreach services, I would say we have gone as far as, providing services to other sub-counties. One thing that I will say again is that, in the eastern part of the country is that we are plagued, with a lot of, scarcity of, that social service, which is called health. So you have a number of people that are not able to access healthcare services because of lack of infrastructure, lack of medical supplies, lack of medical personnel. One thing that I want to say is that, yes, we do work beyond Kayoro. We opened up areas that are medically underserved, providing outreach services, and the reception has been enormous. Among other services that we also provide, I also want to say is that thanks to Give Us Wings is the distribution of the reading glasses. People come from far and beyond to be able to just get these reading glasses. I will tell you, accessing a reading glass is about 70,000 or 100,000, depending thereabout. Uganda, shilling. That's about 30 or about $40. But here is Give Us Wings that is able to provide these reading glasses, at no cost. So people have come from far and really beyond. We've also had cases of people coming from the neighboring country, which is Kenya, when we have the doctor days. Usually what we do a lot of radio announcements or adverts, and people from as far as Kenya usually actually call and say, when is this actual activity taking place? I would like to come and I would like to attend. So we've had very many people coming as far as Kenya. Others have come as far as, other neighboring districts. So as a health center, we do not really block or really segment, where we are able to provide. Our doors are open to everyone, for everyone to be able to access the healthcare service. And one of the beauty about St. John's is where it is located. It's located along a very major highway. So we've had people, getting services, as they're passing by, from Rwanda, from Tanzania, coming to get services. So our services, move far and beyond.
That's great. Okay, just following up on that, when you do those community outreaches to other villages and go other areas, what kinds of things happen there? What services do you provide to those people?
Yeah, when we go to the community outreaches, one thing that I would say is that we provide a lot of, we actually have an integrated, integrated services. Now, integrated services means that we tailor our services. There should be, laboratory testing. There should be family planning services. There should be treatment services. There should be immunization services. There should be health education. There should be, really a host of other services. Now, if you look at other health facilities, the only thing that they do, and I'm talking about in terms of public facilities, they're only able to provide immunization services. So as St. John's, when we open up an outreach site, it is a big deal because very many people are going to be able to know their sugar level. They're able to know how much blood they have in their body. They're able to provide, to access family planning services. And particularly just to talk about the family planning services, this is something that is still a taboo in very many communities. For example, the women, are unable to actually come to the health center for fear, of domestic violence. Their spouses, the male spouses, do not want them to access these services. Unfortunately, in the community setting is that the men are the ones who determine the number of children that their household should have. So the women do not have any say. So when we open up these outreach services and we provide these family planning services in the communities, we are able to take these services much closer to them. they're able to come, not to sneak, because they are always monitored by their spouses when they come to the health center. So this is something that is appreciated, across the board. Yeah.
Thank you. I think the fact that we go out into these rural areas and offer all those different services is really impressive, or at least that's one thing that I have really found impressive. So thanks for explaining that a little bit more. Anthony, can you tell us a time or maybe a couple times when you felt especially proud of the work at the clinic?
I just want to say, for the 10 years that I have worked with Give Us Wings, and in particular to the health center, every single day, I am proud of the work that Give Us Wings does. I am proud of the interventions that the organization has, the impact that is causing on the people. You really see that people's lives are being changed. People's health is improving. This is something that I am proud of. Just to give you a brief background, in 2014, 2015, when we had just, were fairly new, we had so many challenges. People were dying, and they were dying of, preventable diseases like malaria. People were dying out of, lack of information, but when we came on board as an organization, I started seeing people appreciate services. For example, diabetes testing. This is something that not any other facility provides, but Give Us Wings does that. Hemoglobin tests. This is not what any other facility can be able to do, but Give Us Wings does that. I am so proud of that. I'm also proud that, because of the quality of service that people are able to get at St. John's, every single day, you keep hearing someone getting referred from a higher level of, health facility to come to St. John's, where you would actually expect someone to recover. They actually are able to recover. So they come to St. John's, and lo and behold, someone is able to, be able to get the medical care, and someone recovers. There are so many cases that we have received. Some people have even been condemned to death, but when they come to St. John's, like for example, now to Kayoro village to now die. When they come to St. John's, they just take a risk and come to St. John's. These guys get better, so that really makes me proud. People can get back on their feet. We are able to restore life. That is something that is so important, and really, it really makes me proud. I am also proud of the fact that we have also, together with our partners in the US, and also our partners here in the communities, we have been able to shape that health center into a model health facility. Just yesterday, for example, I had a team from Ministry of Health, a gentleman who is in charge of health insurance. He came to St. John's. And when we were moving around and we were having a conversation, he actually said, I would really wish that other health facilities, public health facilities, would actually come and borrow a leaf of what the organization is doing, what the services that we are providing. We don't have much, but we pride ourselves with what we have, and doing quality, being able to have an impact on that poor person. And really, that is something that I am proud of as an employee of Give Us Wings, and a staff member of St. John's Kayoro.
Thanks. That's so great. Just one more question really quickly, because I want to leave a few minutes for questions. And I'll just remind everyone who's listening that if you do have questions, go ahead and throw them in the chat box right now so we can kind of have them queued up. But Anthony, could you just tell me some of your dreams for the future of the healthcare program, the clinic, and the program in general there in Kayoro?
Oh, thank you so much, Peter, for that question. We shall never stop dreaming. We shall continue to keep, we shall keep dreaming until we we can dream no more. I am just one of the things that I see for the future for St. John's, and I think it is something that we can be able to do together, all hands on deck. I actually see a fully fledged hospital being able to provide health interventions to thousands of people, thousands of people. And I believe we are able to do that. We're able to, if we can be able to have, build the infrastructure to support. Of course, whatever we do, one of the beauties about Give Us Wings is that, again, like I said, whenever we are undertaking a particular intervention, it must be based on a need of the community. For example, recently we went to the communities, we had an interaction with them, and they requested for an ultrasound scanning machine. And Give Us Wings was able to provide that early this year. So as we keep moving towards that direction, it is something that I really treasure. I also want to say that the community, of course, is talking so much about us establishing a modern laboratory. That is a dream that I think we need to really, share. Of course, there are many impacts that a laboratory, good diagnostic facility, good diagnostic equipment. There's so much that we can do once we have such kind of things. And I'm happy that we are doing what we can to be able to realize that dream for the communities, because they trust us to be able to really see through the dreams that they have. Of course, also having an ambulance is also something that is quite important. Again, like I said, we have challenges of distance. We want to be able to address these issues. We don't want to see a laboring mother giving birth on the roadside and unfortunately losing an infant. That is something that we really don't want to see. So if we are able to have an ambulance to be able to reach out to the community, if there's any emergencies, if there is need for referral, we are able to provide such services. But also an ambulance is also one of the things that can also be able to help us to also move with medical supplies to the communities. Maybe there could be an emergency and we are called. We're able to arrest a particular situation before it happens. So my dream, again, for St. John's Kayoro Health Center is to actually now be St. John's Kayoro Hospital. And I think we can be able to do this together with the support from everyone.
Yes, that sounds like a great dream indeed. Let's see. It looks like we've got Betsy. Are you reading the chat? It looks like someone came in here. Oh, I guess that's not more of a question, just I guess Adaman is here. And he says that he's been to St. Paul to thank us on behalf of the village there in Cairo, where he is from, and he wants to reiterate that thanks today. So it's great to have you online. And another example, Anthony, of people who are appreciating the work. Can you tell me in the last couple of minutes, Anthony, what your favorite part of the job is?
My favorite part of my job is, well, everything. I want to say everything is quite exciting. In my job, I am able to practice what I am able to accomplish. For example, as a professional, one thing that Give Us Wings has enabled me to do is to really expand the possibilities, and that is something that is very rare. That is something that is very rare for by other employees out there. So I am able to really do more and really to challenge myself to be able to provide the best that I'm able to do. The other part of my job, which is good or is favorite to me, is that when I see people coming and getting cured, for example, children falling sick, coming to the health center, they're able to get treated and playing around when they are recovered. it really excites me, and it motivates me to wake up every day, think about how I can, be better. How can we be better for the community? It's really something that I really hold dear. And of course, again I said, as Give Us Wings, we are need-based. We do whatever we do based on the community needs. So that kind of approach, not very many NGOs have that, and that is something that I appreciate. But something that really moves me on a day-to-day basis is that as an organization, I am given all the support to be able to do all that I am able to do to make the lives of the communities much healthier, much better, and more productive.
Thank you. It is 10:45, but we have one quick question that David brought up here. So Anthony, in maybe 1 minute or so, can you explain, does the government of Uganda provide any assistance to our clinic?
Yes, the government of Uganda provides assistance to our health facility. In terms of financial support, every quarter we receive something which is known as primary healthcare funds. And these primary healthcare funds are able to, we are able to provide community outreach services. It supports that. We are also able to have, things like infection control, waste management. So yes, the government provides us with financial support, but also in terms of material support. On a quarterly basis, we also receive essential medicine to be able to, supplement whatever drugs that we have, to be able to reach out to the poor people. Of course, like I said, we are a private not-for-profit health facility. So because of that fact, the government every quarter gives us, medicines, life-saving medicines. Like, for example, malaria. In the first quarter, we had a lot of, high prevalence of malaria, and the government intervened through the US President's initiative on malaria. So of course, the government works hand in hand with those partners, and these supplies come to our facility. Just last week, we were able to receive mosquito nets that we are going to roll out to pregnant mothers and also children that are below the age of 5. We also receive immunization, vaccines. We also receive vaccines, and these vaccines we receive each week. Each week we receive vaccines from the government to be able to continue providing the immunization, program and support, against the killer diseases in children. But also as well, we also receive technical capacities, trainings. We do receive trainings. We receive, capacity building sessions. Really keep us abreast with, the current happenings in the health, sector. So we work hand in hand with the district, and because of that, we receive a lot of support from them.
Nice, thank you. All right, well, our time is up. But thank you so much, everyone, for being here. I hope you learned a little something about our work in Uganda. If you ever have any follow-up questions or would like to know more, feel free to reach out to me or to Betsy, and we can connect you with the answers that you need. We really want the people that support Give Us Wings to be involved in what's happening and to really know where their dollars are going. Big thank you to Anthony for spending some time with us here on his Friday evening. Hopefully now you can go home and enjoy the rest or enjoy the weekend. Everyone should know that Anthony drove around for about an hour in town trying to find a hotel that would have some power, a generator power that he could hook into. So thanks for that extra effort, and Anthony, thank you for all that you do. We really know that the clinic is in good hands with you there. So thanks everyone. Have a great Friday, and we'll see you again sometime soon.
Thanks, Anthony.
Thank you so much. Yeah. Bye-bye.
Bye.
Bye.
Bye-bye.